Good evening, ladies and gentlemen, and thank you for joining us today for the sixth installment of Suburban Diagnostics Knowledge Spree series of webinars. In a departure from our previous 5 webinars, we will today be using this event to shine a spotlight on the psychological impact of COVID-19. My name is Dr. Vineeth Nair, and I'll be your moderator for today's event. As most of you know, for this webinar, we had solicited questions well in advance for the speaker to address. We had a phenomenal response to this, and I would like to thank all those who sent in their queries. Apart from these questions, we will also try to address any additional queries you may have today at the end of the webinar as time permits. So we encourage you to actively participate by submitting as many questions as you like at any time you want during the presentation. To submit your question, simply type the question into the chat box to your right and click send. If you have any trouble hearing or seeing the presentation, please use the chat box to let us know that you're experiencing a problem. Please note, with this webinar, we will be giving certificates of attendance. All those who complete the webinars and wish to be provided with the certificate must fill a form which we will provide to you at the end of the webinar. This form only asks for your email as well as your name and title as you want it to appear on the certificate. I would now like to introduce our speaker, Dr. Anjali Chhabria, who frankly requires no introduction. She is one of India's leading psychiatrists and psychotherapists and is now the author of Death is Not the Answer, Understanding Suicide and Ways to Prevent It. She runs the reputed Mind Temple, a mental health center which supports the psychiatric, emotional, and behavioral needs of individuals. She is also the founder of the Golden Citizens Trust, which was established in 2018. She's been the president of the Bombay Psychiatric Society in 2001, served on the board of the Children's Film Society, and is currently a director on the Salam Bombay Foundation. Drawing on her vast experience of 27 years, Dr. Anjali will now be sharing insights on the psychological impacts of COVID-19. Without further ado, let me hand over the reins of this webinar to Dr. Anjali. Over to you, ma'am.
A very good afternoon to all of you. I don't know whether we have been exhausted by the COVID or whether we've been exhausted by the webinars, but I'm so happy to see all of you here today. And yes, we don't know what has hit us because none of us have experienced a pandemic in our life before this. And of course, what is bothering us the most is, when people ask us questions, I know a lot of us are doctors over here. When will this end? When will the lockdown end? When will this end? How many people will be affected? Who will be affected? What bothers us most is the fact that there is no certainty. And what we don't like is the uncertainty along this. Because we are so used to giving answers. We are so used to telling people कि malaria hai, 4 दिन दवाई खाओगे, ठीक हो जाओगे. And here, we really don't know what hits us. We see people these days, we've been almost in this since 10 weeks now. And what we are seeing is that we don't even know that the people who are getting affected by the COVID are people who've been sitting at home for the last 2.5, 3 months. And yet, the virus catches them. And then there are those who are going out every day and they seem to be going scot-free. The knowledge that we are receiving or the wrong knowledge that we are receiving via WhatsApps, and ye pati, wo pati, homeopathy, Ayurveda, haldi ka doodh, etc., etc., etc. But yes, we don't have answers. And most of us doctors here are used to having answers. And along with that, the uncertainty of being locked down, what is happening to our relationships, what about finances? I have been talking to people through the day, and a lot of them have the same questions. In fact, we all call this social distancing. I don't like this word social distancing because I think it's physical distancing. I have never interacted with so many people as I have interacted with in the last 10 weeks. My first seminar started with 3,000 people. Then it went on, doing seminars all over the world on the same topic. Because yes, today we are just one flat planet which is affected by everything. Economy has gone down the drain, employment, and in all this, it is not only the physical health, but the mental health which is being affected. And what is happening is the fear and uncertainty is leaving us extremely stressed and feeling extremely powerless over the direction of our life. What is this anxiety according to in COVID? What is happening? 40% of people all over the globe have lost their sleep. Some of us are having nightmares. Some of us go to sleep at night, but we wake up in the middle of the night and we don't know what to do. The other day, I had someone telling me, "Ma'am, you're not sleeping. I saw you online at 4 a.m." I said, "Yeah, what were you doing online at 4 a.m.?" So, this is something that we have all seen in the last 10 weeks. Of course, there is a fear. The ones who are doctors over here not only are fearful about their life, because we all know that 1 out of 3 or 1 out of 5 people getting affected by the COVID is a healthcare worker. We are also scared of coming home and infecting our loved ones. A friend of mine recently did not meet his mother for almost 6 to 8 weeks because he was so scared that he will take the infection home, just to hear that his mom had passed away in her sleep. So we all go through a lot of emotions. We are not eating properly, we are either overeating or under eating, and we are often preoccupied with thoughts of COVID. We are trying to get as much knowledge about COVID. And at the end of the day, I think we are asking the same questions that we were asking at the beginning of this 10 weeks. A lot of us are also feeling restless, are not able to read. A lot of my friends have told me that, we're not even able to concentrate on what we are reading. And often, when you're also meeting people on Google Chats, one common thing is people are constantly thinking that they have symptoms of COVID. Because of that, what we are seeing is the mood is getting affected, either the mood of one person in the house, which is kind of going to the other person, and constantly people are trying to balance each other out. All these are symptoms of the anxiety related to COVID. Now, let me tell you a little bit what are the sources of anxiety for a doctor today. Of course, will I get sick? A lot of doctors at the beginning of this, so far they thought that nothing could happen to them. But I know a lot of friends who said, it's time to make a will, and people actually started doing that. Of course, the society does not make it better. Our work situation does not make it better. The current health of all our health is affected because we are constantly bombarded with phone calls. Every night when I go to sleep, I know I dread a call saying that I need admission to the hospital. Can you help me? Because what happens is, as doctors, we are so used to doing our best that we are constantly then trying to find a way to get somebody who needs oxygen. And by the same time, by the time you get admission into a hospital and call the person up, the person says, "No, no, no, I've already managed. Thank you very much." You don't know what to do then. Of course, there is also an additional anxiety which is happening. Some of us are working in private spaces, some of us are working in public spaces. The lack of having protective gear, which is making so many doctors fall sick and get COVID themselves. Every day we wake up hearing the news of one of our colleagues who's either in hospital or who we have lost to COVID. A few days ago, when we lost two of our popular actors, I remember going on a webinar like this and saying that the entire world, our entire country, is feeling so bad because we've lost two of our popular stars. But this is exactly what doctors have been going through for the last 10 to 15 weeks now, when we wake up in the morning and hear that we have lost someone to COVID. So, because of that, a lot of people are feeling anxious, are feeling depressive, and are feeling extremely pressurized and do not know how to go about it. The frustration and the helplessness is something that is not only in the senior doctors but also in the junior doctors. I constantly chat with interns and residents, and they tell me about how frustrated they feel. Some of them feel frustrated because they are not able to help. Some of them are trying to help and they're not able to help because of what they see in the hospitals. This is, of course, the first pandemic that we're all seeing, and there is no information or little information which we are getting thanks to colleagues all over the world. The lack of a vaccine or the lack of knowing when this is all going to get over is only making it worse. Of course, system related also what happens to doctors. Some of us are not allowed to come back into our own houses because of the society members. Also, when a doctor fell sick recently, his entire society who was relying on him for information actually ostracized him. The authorities don't make it any better. The changing of rules is what we have seen in Mumbai, the lack of beds, all that makes us feel helpless and us feel absolutely overwhelmed with the situation now. The fact is that 4.5 lakh health workers have been affected by this pandemic. And what we are trying to do is the reason why we need to also understand the psychological impact of this and how to combat it is because immunity is linked to our mental health. And that is the need, that is the reason why we need to keep our emotional health in our hands so that we can deal with it in the best possible manner. We do not need to get heroic and say, oh, nothing will happen to me, and go out into the field without being prepared. Or at the same time, we do not need to be sitting at home and saying, oh my God, how am I going to, play games with this virus? How am I going to play hide and seek? And I don't want to be caught. We need to be prepared. We need to be protected. We need to be supported. We need not only to care for ourselves, we need to care for each other, and our voices need to be heard. So what we need to do is come together and help each other as we go through the next few weeks or next few months of this pandemic. So while the virus has physically affected so many people, okay, and of course these numbers are not really the truth of what is happening, because we all know that there are friends of ours who have been affected and maybe they had a mild infection, maybe they got tested, maybe they did not get tested because they were so scared that if they got tested, either they would have to hear ki we had told you not to go to your clinic, but you did not listen, or today you have brought the infection back home or back to the society. And then there were those who continued working because they were in denial, who said, no, this is just a cough, this is just a cold. And soon what happened was we found them in ICUs. So the numbers which are there, I'm sure, are underrepresented. But what we are seeing is that a lot of people are facing burnout, people are getting depressed, people are feeling sad, are crying, and some of them are also wanting to run away from the system. I've often woken up in the middle of the night with someone who's in quarantine who's getting a panic attack because they are so scared. They wake up in the middle of the night, and if they have a bout of cough, they're rushing to check their oxygen levels with their oximeters. And when the oximeter shows you a level of 92 or 95, you feel that, oh, is it a panic attack? And that's when they call up. Now, in this, again, it is a young doctor, it is an old doctor, it could be a resident who has quarantined herself because she does not want to spread the infection to her family. Or it could be an elderly person who is now struggling to get a bed in the hospital. So, of course, the figure is a very, very rough figure. And there are lots and lots more people who are affected by this. A lack of support is something that people face. Now, why does this happen? Because many a times what I have seen my friends, the doctor friends especially, do is they do not ask for help, because so far they are only used to giving help. So a lot of us, because of that, feel unsupported. And there is something that we have been trying to do from the beginning of this pandemic is support each other, support the young doctors who are in the field, support our our colleagues with giving them enough of knowledge, with giving them enough of protective gear, and with helping them fight with the system as and when it is required. Of course, it is extremely exhausting for for medical professionals and also mental health professionals to constantly keep themselves motivated, to keep smiling through this. to hear about a death, to experience a death, and to be worried about your own life and yet to keep yourself going. Some of my colleagues have been quarantined. I'm sure a lot of you have already been quarantined more than once. And at the same time, we are trying to do our best to move ahead. Of course, the phone calls don't make it better. This whole thing about teleconsulting, many a times we all have had to go through this, that, people actually feel, अरे आपने तो phone पे बात किया, इसके पैसे हम क्यों आपको दें? And that is something, or, those of us who give our phone numbers in a generous way to patients, or even if patients find it, people feel that they can call you and disturb you at any point, at any time of the day that they are free, so that you can be there for them. Of course, we also are clouded with phone calls from our relatives, from our neighbors, from anybody who may be getting a little sneeze, and people feel that they can reach out to you. Of course, virtual interaction is happening, but we constantly have to make the rules, because there are some of us who want, the patients want to see us in person. Just yesterday, I had this lady who called me up and said, but you know what? I don't feel satisfied when I have a video call with you. I want to meet you. Now, how much can we satisfy? Will we be able to satisfy everybody around us? Do we even need to satisfy everyone around us? Or do we need to make ourselves a priority? This is the time we need to decide that, while we do full duty to ourselves and to our profession. A lot of guilt. I remember when this entire pandemic started, and a lot of my friends who know me said, you better not go out there and, be there in the field. You are 55, whether you feel it or you don't. And I realized that that was the time that I said, okay, I'm not going to go out in the field, because if people say that, if you're 55 and above, please stay indoors, I shall take that. But the guilt of, I think every day in the first few weeks, I just wanted to get up and go out there to help colleagues, to help the patients in the hospital. Of course, grief, a lot of us have felt grief at losing our patients, at not being able to help people when we want to help them, at not being able to find someone a bed. And the newspapers and the news, the negative news, just does not make it better, And of course, we need to understand and help each other as we are going through this phase. Staying indoors and taking care of ourselves. How do we do it? Now, this is something that can help everybody, not only doctors. What we need to do is, while we are helping others, we also need to help ourselves, and we need to limit our screen time. We are all bombarded with webinars, we are all bombarded with lots and lots of information. Do we need to read every article that comes to us? Do we need to look at the COVID score? How is it helping you to know exactly how many people have been affected? It's not really helping. So I think limiting screen time is really important. What I started doing at the beginning of this was that, divide your day into 5. Okay, now first part of the day, do whatever you're supposed to do, whether it's your online consultations, whether it is reaching out to people, whatever you need to do it one part of the day. Second part of the day is looking after yourself. So whether it is your sleep, whether it's your appetite, whether it is your exercise is something which is extremely important. And I know a lot of people found it difficult to exercise indoors when the entire pandemic started. So we made a simple rule in our house. I said that between 6 and 8 o'clock, everyone's going to exercise. So it was a real funny sight to see somebody jogging, someone dancing, someone, people are getting into each other's way. But we decided that we wanted to do it. And since then, that is something that makes you feel good. Of course, we all are used to having our own form of exercise, and this was a new way to start doing it. But it's so much fun to have some stranger teach you different dance forms every day. I had never done this before. Now, after this, I don't even know whether I want to go on to any other form of exercise. Of course, yoga, meditation helps all of us. It will help us I mean, it has helped us in the past, it will help us now also. And that is something that we must continue to do. Alcohol, I know a lot of my friends were tempted to have alcohol because they used to feel that, oh, at the end of the day, let me just have a drink or two, let me feel good, and let me go to sleep. But this is something that definitely lowers your immunity, and we must stay away from it. So should we stay away from popping in benzodiazepines if they have not been given to you? Okay, because this is something that will give us a short term relief, but it will actually not help us. you know the third thing is whatever learning that we need to do. So the first is doing your work, two is taking care of yourself, third is whatever new things that we wanted to do. We all said that, oh, when I have time, I'm going to do this. So whether it's updating yourself by doing a course, or whether it is cooking, whatever you feel like doing, spending some time doing your hobbies and exploring other parts of you. We have all not come here just as doctors, we have other facets to our personality, and this is the time we should explore that. So, whether it is music, whatever, I know a lot of us have already done that by now, and we are quite tired of it. Reaching out to people. I don't think I've ever reached out to as many people as I have reached out to in the last 10 weeks. And it has been nice to to meet a friend again after a long time, because as doctors, and all of us, why doctors only, all of us are really busy people, and we would never have the time to do that. So that is something that really helps us to connect with ourselves. So picking up the phone and talking to a friend of yours who was in school and laughing about something that happened probably when you were in 5th grade really helps you to de-stress. And of course, there is no better de-stressor than giving back to society. Now, I remember at the beginning of this pandemic, I was feeling extremely helpless and extremely low because I felt I wanted to do something. And that's the time we started using our Golden Citizens Trust to help people. And what started with a small idea, I gathered all my friends who were above 55 and told them, let's do something. When we started helping people, we realized that we could make a lot of difference to people. And we have been doing that, whether it is filing a case against N95, supplying PPEs, mentally supporting, emotionally supporting young and old healthcare workers. And right now, we are planning to do more and more stuff. So, those of us who want to join us in this endeavor, please do that. Of course, working from home is a new ballgame, and it's often a challenge to find a spot. Some of us have become experts in that. And just before the seminar, I was just trying to put my dogs out of the room because they have this habit of coming here and being a part of every seminar that I start off with. So find a good place for yourself. I'm sure we've figured this out. Of course, getting dressed every day is something that there are lots and lots of jokes which we see on how people dress themselves for webinars these days. Financial stress. Doctors, I don't know too many doctors who are good financial planners, but maybe this is the time to cut down extra expenses, to wait for a year or two before you invest in something else, and also to talk to the family. How do we talk to the family about the finances? I think that is a conversation that people must have, whether it's with the kids or whether it's with your entire family. And don't take this burden alone. We have this habit of not sharing, and this is the time to share everything, to share your deepest fears, to share the fact that you feel that the financial may not be enough, and you will be surprised with the kind of expertise or the kind of ease that your family, they may come up with such brilliant solutions. And that is something that is going to help you to feel that, yes, I'm not in it alone. Of course, we all know those financial experts who can help us, and this is the time to take their help. Taking care of elders and children at this time is extremely important. Those of us who have little kids know that kids are getting extremely restless. Those of us who have teenagers know that teenagers cannot study, and that's the last thing you can ask them to do. Some of them have reversed their entire sleep schedule. Yesterday, I was talking to a 9-year-old who sleeps at 2 a.m., because he's so excited that he has the freedom to do so. So it's very, very important to give them clear information. Even little kids, it's extremely important to tell them in a language that they understand, that yes, what is expected out of them, whether it's washing hands, whether it's not meeting friends. And at the same time, keeping an extremely relaxed atmosphere in the house definitely helps, because they are looking at you as a role model. This is the first time something like this is happening to them. So it's extremely important that if you are calm, you will see that the entire house is going to be calm and relaxed. If you're getting anxious, they are going to get anxious too. Giving them, just because you're at home with them, does not mean that you have to be in their space all the time, or they have to be in your space. But please find some time to play games with the kids, and bond at that time too. And at that time, please keep your phones off or keep them on silent. Yes, because if you're a doctor, you can look at it once in maybe 20 minutes or so, but don't keep looking at your phone all the time, because this makes children feel that they are not important. So let's come to this question. This is, according to me, the most important slide in this presentation, because who do I want to be? Do I want to be in the fear zone where I am, working out of anxiety? Whatever message I get, I want to send it to everybody. I'm getting very easily irritated, and my emotions are going up and down. Do I want to shift from there to a learning zone, which I guess all of us who are here have already done that, where we are evaluating information, we are not just spreading anything that we are getting, and we are recognizing that we are trying to do our best. Maybe our best is not good enough, but we are still trying. And at the same time, do I want to move again from identifying my emotions and also going and being living in the present? What is called as mindfulness, or people who practice vipassana, know one thing is that we are just living in the present. So all our worries about the past, about the future, actually do not make any difference, because you are living in the present and you're trying to do whatever you're trying to do. Okay, waking up early in the morning and saying, oh wow, thank god I'm alive. This is another practice which I started doing. I would wake up and say, oh yes, I'm alive. The second thing was, I'm alive in my own house, and that is very, very important. The third thing is, I'm alive, I'm in my own house, and I am not sick. I'm well. So let me do whatever I can do to make this day of mine valuable, whether I need to adapt to new changes, whatever I need to do to help people, at the same time realizing that I'm just a drop in the ocean. But of course, every drop counts. And that is something that if we all start doing, that is something that helps us to not get anxious, to not get fearful, and yes, to not behave that we are God's saviors over here, or we are just going to save the world. We can all try to do whatever we can do. So, what are the coping strategies? Of course, exercise, yoga, meditation, doing a hobby, relaxing, all extremely important. But very, very important is to talk about our feelings. For some people, that comes very easily, and some people have not mastered it. So this is the time that you need to reach out to family, reach out to friends, share your feelings. Share your feelings with your co-workers, with your co-doctors, and you will see that that is going to help you not only to accept what is happening, also to accept your personality, your own flaws, and also help you to do your best without getting anxious. Take a break from the news, laugh, joke, listen to music, dance, okay, and also have a routine where you are doing other things, whether it is gardening, whether it is feeding plant, watering the plants, whether it is just feeding birds outside your window. These are small things, and even doing the daily chores of the day can actually help to relax you. Consider your own limitations. Yes, I know we all want to do our best, we all want to save everybody, but pay attention to yourself. That is extremely important. Do not neglect symptoms. Do not feel that you are Superman. Remember that you are just one more person who is trying to do their best. And also watch the number of hours that you work. We can all get consumed by our work, but we need to share our workload with people around us. We need to talk to people around us. We need to talk about our own frustrations, our own inabilities, and we need to take help. A lot of us don't know how to take help, but maybe this is the time that we need to not only show compassion to others and empathy to others. We need to lead, definitely, but we also need to show compassion to ourselves. And if you're tired, don't hesitate in telling other people that, yes, I'm tired, I want a break, can you take over from me? And yes, of course, none of us know how to cope with this pandemic. We are all here to help each other. You're not alone in this. None of us have the answers. Let's be together and try to do whatever we can. Let's talk not only about our success stories, but also about our failures, because none of us are alone.
Thank you, ma'am, for that crisp and clear presentation. We'll now move on to the Q&A session for the pre-submitted questions. So, as most of you know, we had put out a poll with a series of questions with the opportunity to ask Dr. Anjali a series of questions, and we had a phenomenal response. We had over 130 questions given to us. But due to the constraints of time, what we have done is we have curated those questions and combined all the similar questions together, and these will be presented to Dr. Anjali, and then she can answer them. So most of these questions that we had queries concerning the same few key areas. So to prevent repetition and to address these concerns of all those asking, we have curated all of them into 5 key questions. So we'll be doing that now. So Dr. Anjali, just by far the most asked question is how do people, not just the healthcare workers, but also ordinary people, deal with the stress and the anxiety of lockdown and COVID-19 and the uncertainty of the future? There are a lot of people who have asked questions in this in varying fields. Some have asked about their anxiety of their economic status, about their social status, about how they are not able to meet people, where they feel isolated. And there are others, especially the elder population, who have to stay indoors, who are away from their loved ones. So they also have an anxiety. There's people who are talking about anxieties of getting COVID, or maybe they hear that somebody in the neighborhood's got COVID. So there is a lot of stress, a lot of anxiety, and a paranoia coming in from all directions. So how does one deal with this?
So, first of all, this is again, I think the first thing we need to remind ourselves in this is that we are not alone. Okay, everybody is anxious. People all over the world are anxious. Everybody is staying away from their loved ones. Parents are staying away from their kids. Kids are staying away from their elderly parents. Okay, so we need to remind ourselves on a daily basis that yes, you are not alone. Of course, the fear of getting COVID is something that it plagues a lot of people. Now, again, by accessing ourselves to the real knowledge and reminding ourselves that 80% of the infection is going to be mild and it is only a few people who are going to be really sick. So, what we can do is to allay the anxiety. The first thing we can do is to remember what is in our control and to remind ourselves that everything is not in our control. Now, what we can do with what is in our control is yes, take care of our health, exercise well, sleep well, not get stressed unnecessarily. Now, besides that, yes, if I do fall sick, I can fall sick. Of course, every time if somebody fell sick in the neighborhood, there was so much commotion, there was so much happening. That itself would make people fall emotionally sick, and the stigma of getting affected was adding to the anxiety. Now, this is something that I think by now people have kind of dealt with, And people have also realized that probably if this is an infection that's going to affect 70% of us, yes, it could be me, it could be you, it could be anyone. So, what we can do about the anxiety is to do the best. When we were kids, we were always told that do the best you can and leave the rest. And this is the time to practice that. Do whatever you can do, of course, wash your hands, keep sanitation measures, etc., etc. But yes, do not get paranoid about it. Do not spoil your emotional health by constantly worrying about it. Of course, the elderly are quite affected because they are so scared. They've read everywhere, they've heard everywhere that if they get infected, they're going to die. And because of that, a lot of them are feeling extremely anxious. For all of us who have elderly people around us, please do one thing: spend happy times with them. Limit their television time, especially if they're watching the news. Play games with them. Play simple games like Antakshari with them or board games with them. Talk to them about happy times. This is the best time to get old photographs out. Also, one thing which I started doing with my parents was every time I would meet them, I would talk to them about maybe some when we had gone through stress as kids and how nicely they helped us out of it. I would remind them about those stories. So what would happen is I would see the mood of the environment would and would change, and they would become more relaxed. For those of us who have kids around, just remind yourself that kids are facing this for the first time. So they are going to become a little restless. They are going to bend the rules. You may have a few more broken things in the house, so let it be. Don't keep telling them no for everything. Don't keep on looking at them and trying to discipline them just because you have the time with them. At the same time, help them to make a own schedule for themselves. Some kids like to express, some kids have gone inwards. So there are those who are just locking themselves up in the room and they either want to play games. And at the same time, if they're balancing their life well, if they're finishing their projects, those who are studying, there are those kids who want to stay away from the parents, and because of that they have kind of reversed their sleep cycle. Now if it is working well for them, leave them. But at the same time, if you feel that the kids are getting too anxious, are getting too restless, or getting too worried, I've had kids who've reached out to me saying that we are practicing social distancing, but our parents don't seem to be doing that, and that is making us anxious. So if you feel that you're not able, if you're feeling a little you can't handle it, please reach out. There are so many helplines out there which you can just call up and get individual help for your problems.
Doctor, another question that I thought would merit that was asked with very similar to this is we have to teach our children about the use of masks, about using hand sanitizers and whatnot.
Right.
So is there any practical way that we can do it without traumatizing them with fear over the COVID?
So I think, I don't know how many of us had seen the movie that was Life. I think Life is Beautiful. Yeah, yeah. Where he is going through that war situation with his child, and he almost makes the child feel that it's a game. Okay. Now, if we can use, we can take a few examples from there. So, for example, if we panic, our kids are going to panic. But if we tell them the truth and saying, "Ki, okay, this is an infection. Now, we don't want to get infected. We don't want you getting sick. We don't want to get sick ourselves. So, there are a few things that we can do. And if we make it in a way that it's less stressful, if we are not getting stressed by it, if we are good role models, chances are that our kids are also not going to get stressed about it, and everybody is going to participate. Of course, reminding each other, end of the day, they're children, they will touch here and there, so just reminding them gently, okay, and telling them and playing games in the house and saying, okay, if any of us also flaw, please tell us also how to do it. Maybe watching a video together, watching a movie together, about how to take precautions, because kids are really smart and they understand the audiovisual world better than we do. So I think there are a lot of creative ways, and find out creative ways to do it. Teaching them to wash the mask if it's a cloth mask and dry it in a particular place. Booking your places in the house where you're going to dry your mask. I think if we can make a little, making your own mask. We started off in the house by making masks ourselves. and we provided it to the rest of the, to a neighboring slums, and we were joking about it that we are making designer masks. So I think if you involve things, if you do things in a fun way, things automatically become more relaxed.
Moving on to the next question, this is also related to children. This was quite asked question. What do you think are the effects of this enforced enclosure in the lockdown on students with learning disabilities or short attention spans or ADHD? So, what do you think this is going to be, and is there any way to mitigate the damage it may or may not do?
So a lot of kids have actually got anxious right at the beginning of the lockdown, because what happened was that there were kids who wanted to they were supposed to give their 10th standard exams, 12th standard exams, and suddenly, they were preparing for it, and then the exams did not happen. And a lot of kids got anxious, got depressed, but a lot of them also came up with real creative, fantastic ways to doing good stuff. So I think each kid has their own creativity, and especially kids who are ADHD or who have short attention spans. These are kids who are very, very smart, and they get bored very easily. So keeping them busy, of course, is challenging, but at the same time, getting them to do house chores, getting them to clean up your house, maybe this is the best time to do that. Getting them to say, okay, okay, come on, let's look at what you don't use from your cupboards, and telling them and putting them in charge, telling them to curate a different meal. So if we come up with creative ways like this and get them involved in your housework, and also, I've had kids who've come up with fantastic stuff. Yesterday, one 10th standard child who was looking forward to his exams, he told me as to how he has started making music, and he said, can I share my video with you? Will you put it on your Insta account? So I think if we are involved with them, and I think the biggest mistake parents make is that we don't listen to our kids. We just expect them to listen to us. So parenting and developing a good relationship, this is the time to do it. And the trick to doing that is 90% listening to them, and just give your inputs when and where they are required. And of course, giving them their space too. That is extremely important. Of course, there can be long term, there will be long term issues, which we will have to see, because man is a social being. We are not used to being locked down, but at the same time, reminding ourselves and reminding them that this is the best way to move forward, and keeping a watch, especially to kids who are vulnerable, and keeping a watch on them, because a lot of them have also started experimenting with stuff on their social media. So keeping a watch on what they are doing and correcting them when required is also important.
Thank you, ma'am. Before we move on to the next question, I have a small announcement for the audience. We'll be collecting the details of the attendees for the certificates. If you look at the chat box on the top right, you will notice that a link has been posted. Please click this link and enter your details exactly how you want into the certificate. Once you've entered these details and submitted the form, you will also receive a certificate of attendance in your email inbox within 7 working days. Also, please note that I've just made a poll live. Kindly rate our webinar in terms of content from 1 to 10, with 10 being the highest score. Back to the questions, ma'am. This is another question that's been leaving us. How do you deal with physician burnout during COVID times, when you can't really take a break or leave from work owing to your responsibilities towards patient care? I think it was, personally for me, I think it was in Eric Segal's Doctors that I first learned of the concept of the wounded healer. And that seems to be quite the forefront today, with a lot of doctors being forced to work not only because they have to, but because they want to. At the same time, not having the time to take a little bit of rest or a little bit of mental break. So how can they deal with it, and how can they not burn out? Is there any way for that?
Yes, yes. So what we started, in fact, at the beginning of this COVID was, we started connecting with a lot of doctors, with a lot of intensivists, because they are the ones who are constantly, and I was talking to intensivists, and they would tell me that, in 30 years of our career, we have never seen things like that. And what I did see was a lot of fear, fear in their eyes. I remember meeting a policeman on duty. I saw fear in his eyes too. So what was quite universal was that, yes, people were getting stressed out, people were getting burnt out, and yet that you have to move on. So I think there is not one answer for this, But what we need to do is we need to figure out what is the one thing that makes me feel good. For someone, it's singing a song. For someone, it's just going for a walk. For someone, it is reaching out to their loved ones. For someone, it's playing a game of Ludo with their kids. Okay, let's discover what is that one thing that makes me smile. Whether it is, these days, so we can't even say we want a hug from our loved ones because a lot of doctors are not even touching their loved ones or going close to them. But I think it is, reaching out to friends and talking, and talking nonsense, that is gossiping. These are small things which really make us feel good. And of course, a lot of us also feel good when we receive a message, from some patient who says that, oh, thanks for putting me in the hospital on in time, I've come back feeling good. So I think sharing this and, and talking about your feelings is really important. So please reach out to whoever you can, and you will see how you feel good just when you have unburdened yourself. And that doesn't take time. You can do it on your way to work, you can do it on your way back from work. And of course, there are those who feel good when they've done short meditations, when they've done just maybe dancing for 5 minutes for someone makes them feel good and energetic.
True, true, very true. The next question is also similar to this. Again, as many studies
Mm.
have shown, the suicide rates and the rates of depression in doctors are quite high. Some say as high
Right.
as 30% in, especially in depression. So how? And there are a lot of cases where I've read that it's not diagnosed on time. So how
Yes.
do you identify and treat depression in healthcare workers? How do you
Right.
get to it
It's
early?
it's extremely important, just as we have denial with COVID, when people are, even if they have fever, they have cough, as doctors, we feel no, 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 I can't get COVID because I'm greater than COVID. Similarly, doctors feel that doctors or healthcare workers think that they cannot get depression, because depression is a bad word. Okay, but it's
Hmm.
important to understand that anyone can fall sick, and just as anyone can get COVID or anyone can get a fracture, similarly, anyone can get depression. And it's like every day when you're going to a mortuary, that is what we are doing today. Every day we are going to places which are not the best, so we are going to fall prey to depression. The best thing is to identify it early. Okay. And even if you are wrong in identifying it, so be it. It's okay. Today, no doctor is going to just take you and put you on antidepressants or say that, okay, maybe just by talking about it, you're going to feel good. And if your doctor feels that you need to take a medicine, please take it. Lack of sleep, not eating properly, crying, feeling sad, feeling overwhelmed, not wanting to go to work, or not wanting to come away from work. These are some of the symptoms that we may see. So it's important that if you're feeling overwhelmed, no harm, pick up the phone. All of us know psychiatrists. Just say, listen, I want to chat with you. And if some of us, you don't want to talk to someone, there are so many helpline numbers. Just reach out and just talk. And if the doctor says take a pill, take it. Don't hesitate. You're anyway taking so many HCQs and things which you don't even know are helping you or not. So might as
Yeah.
well take something that's going to help you.
Very true, very true. So another point regarding depression in healthcare workers is there anything that employers or hospitals or smaller clinics they can do to make the work environment better so that these kind of things can be identified or at least staved away? Is there any measure
So
they can put in place?
it's extremely important for people, especially who are at the heads of the institution, to look out for their healthcare workers, to also see that they're giving them enough time to relax in between. Okay, to also entertain them, not keep, and also not keep a grim face, the same way I spoke about not keeping a grim environment in the house as a parent.
Hmm.
Similarly, and also to reach out. What we started doing at the beginning of the lockdown was once a week we would chat and just talk about anything and find out how we were all coping with my team of counselors. So 10 of us would get onto a call and everybody would share, whether they were not able to sleep, whether they were not eating well, if anyone was feeling sick, and that is something that we should do. Of course, the first thing is to recognize depression and to not be in denial, and to get help for people as soon as you recognize it.
Just for those, just a point of elucidation for those who don't know, what would you point out as the main things that you should look out for when you suspect depression?
So the first thing is a depressed mood most of the day, insomnia or hypersomnia, not eating or overeating, and a feeling of helplessness, hopelessness, worthlessness, when you're working. Okay, and at the same time people who are depressed may feel, they get weepy, they start crying, or they may have a low mood, or they may have something which is which we call as a no mood, so
Hmm.
absolutely feel detached and not talk about anything at all. So when people get too withdrawn, that's also something that we need to look for. And then there are those who are overcompensating,
Okay.
which we call as a agitated depression or a smiling depression, where
Hmm.
they will not talk, but people who know them know that they're getting affected. So if you know anyone who you feel whose mood has changed, please, it's better to take help faster than to realize later and say, oh, I wish I had helped my friend out, or I wish I had helped my coworker.
And the last question in the of the curated ones anyway is that how do you maintain a work-life balance working from home? A lot of people have asked that many of them, including certain portions of the healthcare system, are now working from home, especially the supportive teams.
Right, right.
So how do you maintain a work-life balance when you are expected to work from home and they don't your private life and your professional life collide?
So I think that this is also something that a lot of people were finding it difficult to do, and especially working women, because suddenly their kids were seeing them at home and they expected, and their in-laws expected them to make chapatis for them because they were at home. So this was really difficult. But I think it's important to communicate to people around, because people around don't know what is expected from them. So I think if you start communicating, and of course demarcate it for yourself too. So keeping a routine for yourself is extremely important. Waking up on time and getting out of bed is extremely important. Many times what people were doing is using their bed for everything, eating, working, sleeping, and because of that also they were getting a lot of insomnia. So the minute you wake up, first 15 minutes of the of as soon as you wake up, please get out of bed, get ready, okay, and find yourself a designated place. Keep your routine intact, that means eating on time, okay, and also know what time you're going to switch off. Just because you're at home does not mean that you have to work the entire day or not work the entire day. So I think this is something, but by now I guess people have already have been able to balance both the things. But what is really important is to communicate with each other and to find a common time where everybody can relax and do something together.
Thank you, Doctor. And now we'll move on to a few questions that have been asked while we've been having this session. So, one question that's been asked quite a bit, is what are the changes in the human body that you can expect due to this kind of stress and anxiety? Are there any physical manifestations that you usually see?
So what happens is, with stress, what we see is that the stress actually, I mean, this is to the doctors over here, is that there is something in our brain which is called the pituitary, and there is hypothalamus. Now the road between the hypothalamus and the pituitary, which is known as the axis, that is what gets first affected when you're stressed. Now when the stress, see, all of us are stressed, but what we need to see is that the stress does not become distress, and the distress does not become depression. So some of the changes that we may see are just physiological changes like sleep pattern changes, eating changes, okay, and we see our mood is suddenly getting irritable and we are getting snappy with each other, okay. Of course, if the stress continues to be so, we may see even physical changes, like some of us may put on too much weight, or some women could start having changes in their menstrual cycle as well. Our thyroid may get affected, the blood sugar gets affected, our blood pressure gets affected. Now if you feel that this is happening, that means you're already moving from stress to distress. This is the time to see what is stressing me out. Is it my work? Is it something at home? Is it something in me that is stressing me out? If I'm a perfectionist and I'm not able to do what I expect myself to do, then do I need to change myself? So once you identify the source of the stress, that is the time you need to again see whether you can do anything about it or you can't do anything about it. So we go back to that, change what you can and accept what you can't change. And then, and again, talk about it to people, whoever you think can help you out in this.
Another question that has been asked is basically many doctors are feeling ostracized when they come
Right,
back home despite having
right,
put in long hours. How they're asking, how do we deal with that when neighbors who we've joked around, partied with over the long
right.
over all these years suddenly turn on you? How do you deal with that?
I think this is the time to confront them gently, to remind them about how you've always been there for them and how you are not happy getting COVID or getting your family members sick. So it's important to be firm and to be nice. So if you are a part of a group chat, of course, we can keep on helping the neighbors and telling them what they should do and what they should not do. But if they are behaving badly, I'm sure we all have friends who can also talk for us. Okay.
Hmm.
And you can get these friends to talk about it. And again, there's no harm if you're feeling bad. See, what also happens is people don't expect doctors to feel anything. They feel doctors are, in some ways they feel that doctors have no feelings, or they should be able to deal with everything. So
True.
just very firmly say that, I'm feeling really bad, that I think I've been one of you and I have helped all of you out. And today, when you all are looking at me, you know, it hurts me. I think the minute you say that on a society chat, there will be two, three people who will jump up to your rescue. And
Hmm.
and of course, we need to maintain whatever social norm that we need to do. I realized that for me, when I was doing my NGO work, it was very natural for me to have ambulances come to my society gate to either pick up PPEs or to pick up stuff. Of course, it was bad that ambulances were coming because you don't want the ambulance to be used for a purpose like this. But
True.
then I realized that the entire society was getting damn stressed to have an ambulance come 3 times a day.
Yeah.
So I think as doctors also we need to realize that some things which are normal for us may not be normal for other people. So we are cognizant of that.
Another question is how to deal with the media paradox. We rely on the media for information, but that
Right,
media itself actually does more harm than good with all the negative news and the reiteration of COVID-19, COVID-19. So,
right.
how do you deal with that paradox?
So, as doctors, we are lucky, or I think anybody today, like I have downloaded a WHO site which gives you authentic information.
Hmm.
Of course, nowadays that is also questioned. but but at the same time, I think we need to rely on reliable sites and not get carried away with the news which is coming. And I think a lot of people at the beginning of this only have decided to not watch the COVID score like a cricket score. Those of us who are still doing it need to remind ourselves that there are other channels that we can see, and to not get caught up with every message that comes. Of course, keeping away from your phone at night is extremely important. In fact, before we sleep, it's important that we switch off all gadgets and maybe take a book and read, you know
Hmm.
and or listen to some nice music and not read again about COVID.
Yes, true. But I think it's a little bit easier said than done for most
Yes,
people.
yes, yes.
Yeah.
But we have to train ourselves. You see,
Yeah.
once you train
Very.
yourself, then it becomes a habit.
Yes. This is a slightly different question we've been getting because most of the questions have dealt with how do you deal with the isolation, how do you deal with being alone, not being able to meet your
Yeah,
friends. I have a couple of questions where people have asked. We are now all living in the same house where earlier we used to go out to work and then meet for certain amounts of time in the
right,
day. Now
right,
we're all stuck cooped together in the same house, and
right,
one person has complained of having no me time.
right,
Another
right,
person is that there's no personal space, and so there's a
right,
lot of friction there. So how do
right.
you deal with that also?
Yeah, in fact, that was one of our biggest concerns at the beginning of this, because news was coming in from China where the rates of divorce had really gone high,
Yes, yeah.
right? So I think that was also, I mean, we started having seminars on how to deal with relationships during COVID. So one is giving each other space, two is finding space, and especially in a city like Mumbai, where as it is we are cramped for space, it was pretty challenging,
Yeah.
you know But I guess, and also again communicating about how much space you need. Many a times what happened was that couples saw each other at home, and they would just presume that I remember my husband asking me at the beginning, he's saying, full day or you're on your phone. I said, yeah, but I'm working on my phone. you know so it was a little funny. And then we started communicating about it, and also communicating at the beginning of the day as to what the day was supposed to be like. you know and then seeing and asking each other how much space they needed. Of course, with young children, they seem to need all the space. So even if you disturb them once in 4 days, they say you're disturbing me too much. But I think when we identify how much space we need, that is something that. And of course, a lot of people have also reached out to us for couples counseling, saying that we thought that we didn't have problems, but COVID has taught us that we have a lot of issues which we need to deal with. So maybe this is the best time that you can reach out
So
for
COVID,
counseling.
So
Yes,
COVID's become an amplifying lens basically on any problems
yes,
that may have been
yes.
under the surface. So I think we're almost about out of time. So before that, another couple of questions that we have asked is a lot of people have asked of any particular helpline number or any service that they can go to if they are feeling bad. Is there anything you can recommend, Doctor?
Right, right. There are a lot of helplines. What I'll do is I'll share those with you and let people suit what is best for them. Okay, I'll just
Sure.
send you that and you can just share
We
it.
will share it with the
Yeah,
with all the
yeah, yeah.
registrations here. And another thing is that a lot of them have asked again. I don't know if you'll be able to help them with this. Is there any specific yoga or meditation that you can help that you can recommend that would help with them?
So the thing is, meditation is very, very specific for a person. Okay.
Hmm.
So, for example, say to me, singing is meditation. To someone else, dancing may be meditation. But we are very, very lucky that today we have so many apps. So, what I would suggest is that find something that helps you. Because there are those who can do a pranayam very easily. Those are the people who can quieten their minds very easily, and someone else may have to cycle vigorously to feel good. So are you
True.
the aerobic type? If you are, then do some jumping, dancing exercise, whatever, skipping 500 times a day, push-ups. And if you are a person who just wants to calm down, then just try a lot of the meditation apps. There are a lot of free ones as well, so you can choose those and see what helps you.
That's all the time we have for today. I'd like to thank Dr. Anjali for an absolutely phenomenal session and to all the attendees for joining us today and for their very interesting questions. We've covered a lot of things which have resonated, I think, with a lot of people who have attended today. We will be emailing a link of this link to the recording of this webinar to all the attendees within 24 to 48 hours. We'll also include the numbers and the information that Dr. Anjali will be sharing with us. You will be able to watch the webinar at your convenience. Please feel free to forward the link to your colleagues who may have missed today's session. Till we meet again for another webinar, stay safe. Dr. Anjali, thank you once again.
Thank you.
And
Thank you for calling
thank you,
me.
everyone. We'll see you again for the next webinar.